Invisalign is a form of orthodontics, and everybody is familiar with braces, having the wires and the brackets, and typically you would do that with teenagers, adolescents and teenagers. But now, in unprecedented numbers, adults are having their teeth straightened. Adults that say, I just never had that chance as a kid to have my teeth straightened, and it bothers me. It bothers my smile, and I know it bothers me because when I smile in pictures, I don't show any teeth. Okay? And we all know what I'm talking about. There's just certain people that are very self-conscious because their teeth aren't straight or for whatever reason. And so one of the new options is this Invisalign. Clayton's got these trays. They're clear plastic trays that are custom made to your teeth, and it's all computerized. It's really phenomenal. We make molds of your teeth, take photographs and x-rays and that sort of thing, and we come up with a plan. And you wear this set of trays 24 hours a day, and you just take them out to eat, brush your teeth, and put them right back in, and it moves your teeth just incrementally, ever so much, each time. And you wear that set of trays for 2 weeks. You take set 1 out, put it out, set 2, put in, and each one just kind of oofs the teeth just a smidge, and it starts moving them and correcting the bite just like braces would. Only people can't really tell you have them in. If somebody's really close to you, or somebody very, gets about 12 inches away, they can see or tell. But other than that, people don't even know. Our patients say all the time, they don't even know you have them in. So a lot of adults are having braces without having braces, having Invisalign. So there's a cosmetic benefit to straighten the teeth, but there's also a functional benefit. We're using them where people have really crooked teeth and they're having gum problems as a result because they get food stuck in there. We're using them with cases where we want to do an implant on somebody, but the teeth are too close together, where you just have a skinny little space. It's too skinny for a tooth. So you separate the teeth and create a normal, healthy space, and then you put a tooth in there. So there are a lot of ways that Invisalign, as a form of orthodontics, rather than the wire braces, are helping adults. And it's really kind of an exciting opportunity for a lot of people, especially people that have always sort of wanted to do that, but when they were a kid they didn't have the money, or as an adult they didn't want to have braces, they were self-conscious about it, and now they can. So that's really a neat opportunity.
Jay, let me ask him, how old would you think my oldest Invisalign patient is right now? Did everybody see the clear plastic trays? You may not want to wear braces, you might feel like a teenager, but would you wear an invisible clear plastic tray for 6 months or 9 months to straighten crooked teeth? Sometimes teeth move and get crooked with age, and straighten them to the smile you had in your youth. Let's hear a guess. How old is my oldest Invisalign patient? What would you guess?
70.
Older than 70. Will be 80 this year. Already 80? Sorry, okay, my wife's correcting me. Already 80. Happens to be my mother-in-law. Uh-oh, there goes the privacy. There goes that privacy law. Okay. But straightening your teeth. And as I said, sometimes Jay said, maybe I wish I had braces as a kid, but we didn't have the money for it. Sometimes your teeth are straight when you're a kid, and they just start shifting with age. And crooked teeth contribute to gum disease. So Invisalign has opened the door to many, many people to straighten their teeth. Now,
did you guess that right? Here's a Cinderella sticker for you.
Oh, a prize. You gotta get a prize for going to the dentist. Okay. If you're curious as to what, every dentist charges a little something different, but if you're wanting to say, I wonder what that costs. If you were to do, is it okay to say? If you were to do a full mouth Invisalign case, it would be about, crooked teeth everywhere, about $5,000. And it may take a year to a year and a half. Sometimes somebody says, I'm just interested in these front ones, my back teeth are okay. About $2,500, might take 6 months. Something like that.
And in case you haven't heard lately, the average case for a teenager for braces is about $7,000. That's the current fee.
So less expensive
in the market today.
And faster and more aesthetic.
So that's just the way. That's things go up, and that's one of them. That's currently where it is.
Go in.
Okay. Look.
And we need the